ductus arteriosus kay ang oxygenated blood shunts from the aorta to the pulmonary artery and lungs. So balik ta sa to ang so dire mag-start sa vena cava ang deoxygenated blood. Mato siya sa right atrium, then right ventricle, then moato siya sa pulmonary artery. Then pagbalik niya sa pulmonary artery na oxygenated na siya. So moato siya sa left atrium, then right ventricle para i-adto niya sa aorta, then to the rest of the body. But ang nahitabo diri kay ang kaning oxygenated na blood mubalik siya sa pulmonary artery. Unsa may mahitabo kung mubalik siya sa pulmonary artery? Mubalik na po siya diri padulong sa lungs. Then balik na po siya sa left atrium. Then balik na po siya sa left ventricle. So nagtuyok-tuyok ra ni siya diri. Kapil po diri. Tuyok-tuyok ra jud na siya. So gamay ra ang maadto sa rest of the body ba. So muna yung nahitabo sa PDA. Kay ang kuan man good ang like during pagka anak nimo mag first breath na ka, during the first breath dapat mawala na ni siya nga part sa lawas. We call ductus arteriosus. Kay sa baby pa kay dili man good mag-use og lungs para ma-oxygenate ang kuan kay dili pa mature ang lungs. So mulikay ta diri sa padulong sa lang sa pulmonary artery. So dito siya dito moagi siya sa munang magamit tag PDA ductus arteriosus kay para somehow makabalik siya dito sa kaning umbilical villi, placental villi. Kay di man ni magamit again ang lungs, pero karon kagawas na ta sa KK. Kay kuan man maggamit naman nato ang lungs pag first breath, dapat mawala na niya ang mga PDA patients wala ning close ang ilahang kuan. So muna siya magka right ventricle hypertrophy. Ganun man. Okay, nag-try siya kayo o kuan kanang pressure ba? Pressure kay siya diha nga yadto sa pulmonary artery. Ang kanipong diri nana po ni siya resistance. So like kailangan kayo mag-push ang heart bitaw para to do its job. Boy nang magka heart failure kay fatigue ang heart. So magka-wild force pressure siya, difference between systolic and diastolic. So dako kay pressure no. Measures peripheral resistance. So sa sa mga extremities. So gamay ang diastolic pressure because the shunt of blood reduces resistance. So sa ganing meaning sa shunt. So like shunt is kanang likay, like new root. The shunt of blood ni di ba lahi ang kuan katong ang shunt manggod katong aorta adto siya sa pulmonary artery, reduces resistance. Unsay pa so so loud machinery like murmur is characteristic atong dito na part kay loud machinery like murmur. So diagnosis kay same ra siya sa ventricular, same ra. So ineffective cardiopulmonary and peripheral tissue perfusion, decreased cardiac output, activity intolerance, and risk for infection. So mga interventions na to is mag-give tag indomethacin or ibuprofen, mga sila, mga NSAIDs or prostaglandin inhibitors to close the ductus arteriosus. So surgical management same pod na maghatag tag dacron coated stainless steel by interventional cardiac catheterization when the child is 6 months to 1 year of age. So paano jud no? So large defects are closed by ductal ligation. Tahion jud siya para mo-close. Ligation is tahion. So we move on now to coarctation of aorta. So narrowing of the aorta. So kani siya ning constrict siya. So asa man ang high pressure diri siguro leading to congestive heart failure. Types of coarctation of aorta. We have preductal constriction exists between the subclavian artery and ductus arteriosus. So subclavian artery kay nato siya diri dapit. And postductal constriction is distal to ductus arteriosus. So this dool siya diri. Dool sa ductus arteriosus. Okay. Narrowed lumen of aorta, difficulty for blood to pass, increased pressure proximal to coarctation, and decreased distal to it. So narrowed ang lumen sa aorta, muna diri ang nadire, difficulty na mugawas ang blood payong sa extremities. Increased pressure proximal to the coarcation, diri lagi ang dagag pressure, and decreased paaway sa it. So elevated ang BP ana kay bounding pulse man. So mag-work po harder ang heart ani, and decreased in the lower extremities. So kusog kayo ang pulse sa heart tapit, pero sa lower extremities kay halaga may kaayo. Absent or weak femoral pulses. So asa dapit ang femoral pulses kuan diri sa kamot, di ba? So epistaxis, nose bleeding, headaches, fainting, and lower leg cramps. So decreased cardiac output, ineffective cardiopulmonary and peripheral tissue perfusion. So how do we treat coarctation of aorta? It's a removal of the narrowed portion. So to ang tangtangon ng narrowed portion, and anastomosis of the new ends. So saan pag-perform ng anastomosis of the new ends? So surgical repair, balloon angioplasty. So I think atong is so what again is the interventions for coarctation of aorta: removal and anastomosis. Sa ganito i-removal nato of the narrowed portion. So tangtangan nato ang aorta and pasabot sa anastomosis. So mo na to siya, then magballoon angioplasty pud ta kani. So review sa left to right shunt sa cyanotic heart disease, retain normal levels of oxyhemoglobin saturation in the systemic circulation. Bantog cyanotic dili siya mag-blue kay yung oxygen hemoglobin saturation sa systemic kay medyo okay pa siya, although na siya problem. So increased pressure in the pulmonary artery and right ventricular hypertrophy, and increased pulmonary blood flow. Ano man. So PDA, so kailangan nimo differentiate jud no, kanang maklaro jud nato kayo ba sa difference nila. So PDA kay ligation of the duct ang need nimo buntaton, iligate nato siya, wala na to ang bangag between the pulmonary artery and ang aorta. So wala na to ang ductus arteriosus. So coarctation of aorta, increased pressure proximal to the coarcation, and decrease and removal of the narrowed portion, and anastomosis ang intervention. So again, sa tinuod lang kay naglibog ko unsa jay kanang flow bitaw sa kuan, like pulos sa ductus arteriosus kay we know nga aorta diha dire ang kuan pulmonary artery, connection siya para ma-shunt away from the lungs, pero unsaon man na siya niya pagbuhat. So that's something na kailangan pa nako siya i-dive into. So mag-move on ta sa congenital heart defects nga cyanotic. So mag-blue mulagom na jud ang bata. So first is tetralogy ifalo, which is my favorite. Okay, na siya upat ka anomalies. So ventricular septal defects, so katong dere, pulmonary kay bangag between the ventricles. So if I would be able to change this a little bit, so ang ako ang kuan kay proof, no? So pulmonary stenosis, dayon R is right hypertrophy, right ventricle hypertrophy, overriding of the aorta, and so to ventricular septal defects. So diri nanarrow ang kuan, nanarrow ni ang pulmonary artery. Munang ang right ventricular kay dako siyang effort para i-adto sa ang deoxygenated blood sa pulmonary artery padulong sa lungs. Unya kay tungod sa kadako na pressure diri kaning nabuslot ang kuan between sa ventricles. Unya kay tungod sa buslot kay murag na hiwi pud ning aorta, nana pud siya diri sa right atrium nag-connect imbes sa right ventricle nag-connect imbes sa left ventricle nag-connect. So ang nahitabo nagbalik-balik ang kuan kaning deoxygenated blood padulong sa lawas, like ang right pud kay ang oxygenated pud ang balik-balik ra pud sa lungs. So mura siyang nahitabo. So overriding of the aorta is positioned directly over a ventricular septal defect. So dito sa kuano sa diri sa iyang tunga nila, instead of sa lower left ventricle receives more blood from the right ventricle because of the pulmonary stenosis baya kay kailangan kanya i-push. So ma-decrease ang O2 in the blood. So because of pulmonary stenosis, pressure builds up in the right side of the heart, correct? So blood shunts from the area of increased pressure into the left ventricle and the overriding aorta. So dili siya madto sa right ventricle, sa left ventricle, but sa iyo overriding aorta siya. So increased workload on the right ventricle causes hypertrophy. So muna siya makakause ni siya og death spells. So unsa nang death spells? Fainting and a hypoxic episode. So unsay dagway sa hypoxic episode? Caused by decreased oxygen supply to the brain. So katong PDA ganina makakause siya irritability and napud siya hypoxia. Pero kani kay decrease na jud kayong supply sa oxygen sa brain, as after crying or exertion, muna hypoxic episode and ma-faint ang bata, makuyapan siya. Polycythemia increase, so the body attempts to provide enough RBC to supply oxygen to all parts. So muna nag-attempt ang body ba nga tagaan og RBC, red blood cells ang tanan part sa body. So ang hitabo kay ning pilit kaayo ang blood. So, magka-form siya blood clots which could lead to thrombophlebitis, embolism, and cerebrovascular accident or stroke. So, ineffective cardiopulmonary and peripheral tissue perfusion, activity intolerance, and fatigue. Sa to, ineffective cardiopulmonary and peripheral tissue perfusion, activity intolerance, and fatigue. So put the infant in knee chest position during hypoxic episodes to trap the blood in the lower extremities. So para ganun kailangan i-trap ang blood in the lower extremities. So para ma-keep ang blood sa lower extremities, para mahatagan og oxygen ang mga lower extremities and keep the heart from being overwhelmed. So sorry kayo your heart ha, kay nago jud kay trabaho. So we also administer morphine sulfate, which is a para dili ra kaayo hago ang heart. musculoskeletal procedure, right, is the treatment, palliative, curative treatment we have for tetralogy of Fallot, and in which we kind of get the left subclavian artery and we connect it to the pulmonary artery to shunt or direct between the aorta and the pulmonary arteries. So mag-bypass, so mag-change route siya, which allows the blood to leave the aorta and enter the pulmonary artery, which para ma-oxygenate na ang lungs ngano di ay, and ma-return to siya to the left side of the aorta and to the body. Kay kuan mo gud ang naa dito na nahatag na blood kay deoxygenated, so ipabalik siya sa lungs through the left pulmonary artery. Pabalik siya sa lungs para ma-oxygenated siya. So subclavian artery is used sa Blalock-Taussig procedure. We also have another na procedure di ay, which the start with speaky hapon, but it involves the Dacron patch and pero wala siya giapil diri ni ma'am. It involves the Dacron patch ang second, but the first one is imuhang ipadako ang pulmonary stenosis. So comment down below what is that if you have time, but the child will not have palpable pulses in the affected arm post-procedure. So, walay pulse sa kung aha dapit ang subclavian artery gikuha sa right bar sa left. So, BP and venipuncture should be not be included in the what type of arm. So, transposition of the great vessels. Wala ko nilantaw ang video ani. Nilantaw sa ako. Pero naaraman sa kuan kay aorta arises from the right ventricle instead of the left, and the pulmonary artery arises from the left ventricle instead of the right. So normally the aorta arises from the left ventricle. So karon sa transposition of great vessels sa right ventricle siya naka-connect, and ang pulmonary artery po from the left ventricle siya naka-connect. So nagbalik-balik ra jud sila og blood, no communication system between the systemic and pulmonary circulations. Management is iuli jud nato sila sa ilang respective na partner. So no murmur, or there may be murmurs depending on the shunting of blood. So echocardiography reveals an enlarged heart. Cardiac catheterization reveals low oxygen saturation resulting from mixing blood. So the ineffective pulmonary and peripheral tissue perfusion, activity intolerance, and fatigue. So sa interventions na to anikis, also mag-give tag prostaglandin E inhibitor as administered to maintain PDA. So sa patent ductus arteriosus to na kuan kaning so patent ductus arteriosus to gi-deliver para ma-deliver ang oxygen blood from pulmonary arteries to the system. Kailangan og opening bantog PDA ha para ma-deliver ang oxygenated blood from the pulmonary to the aorta to the system. Kailangan og opening bantog PDA. So ang prostaglandin E inhibitor kay ipa-maintain man gud niya ang ductus arteriosus. So surgical management, balloon atrial septal pull through operation to enlarge the septal openings during the infant's first day. So okay, ipa-maintain ang patency sa ductus arteriosus. Then surgical management is balloon atrial septal pull through operation to enlarge the septal openings during the infant's first few days. Arterial switch procedure within the first few weeks of the surgical procedure of choice. Then we have Kawasaki disease, which ang iyahang pathognomonic sign is strawberry red tongue. So mucocutaneous lymph node syndrome is also the other name for Kawasaki disease because it affects the mucocutaneous, the mucosal part, the lymph node, and also what else? So, ang baby is going to be in a fever, and it is a multi-system disorder. That's why it's called mucocutaneous. So mucus sa skin, sa lymph nodes, and also sa cardiac, diba? Commonly affects children before the age of puberty. We have the etiology or pathophysiology. It is caused by an upper respiratory tract infection and altered na immune function, which leads to altered in increased antibody production, increased antigen antibody. So complexes bind to the vascular epithelium, inflammation of blood vessels, platelet accumulation, thrombi formation, obstruction of the heart and vessels. So, ano nang cause? Vasculitis, the inflammation of the blood vessels, is the principal and life-threatening finding leading to aneurysm and myocardial infarction. So, di ba kay nagka-inflammation sa blood vessels, nag-accumulate ang mga platelets, so nag-obstruction. So, that could lead to aneurysm, which is a rupture, di ba, ng aneurysm. Dangerous abnormal bulge or bulging in a weakened artery, most commonly occurring in the aorta. Bulge in a weakening of the aorta, so possible siya mo erupt, diba? So, what is the signs and symptoms of Kawasaki disease? So, how do we assess for it? Diba kay na siya febrile ang patient, so fever for more than 5 days, 5 or more days that does not respond to antipyretics. Sa may example na to, strawberry tongue and red cracked lips, swelling of lymph nodes, joints, swelling, pain, cervical lymphadenopathy, so pain, ineffective peripheral tissue perfusion. So how do we intervene with this? We observe first signs of heart failure, tachycardia, dyspnea, and rales. Because Kawasaki disease, because of the constriction, there will be more effort for the heart to pump blood throughout the other parts of the body. So inspect peripheries for color and palate and warmth. So magka-heart failure pa din ni Kawasaki, no? So offer extra fluids to maintain hydration, especially during fever, because fever is a really dehydration causing mechanism. So apply lip balm, keep the child free from heavy blankets or clothing because magka-init siya sa mold. So medical management, acetyl salicylic acid, aspirin to block platelet aggregation. So again, di ba, nag-platelet aggregation siya because of the inflammation. So magka siya thrombi formation, which could possibly lead to aneurysm or myocardial infarction. So CMAB, a platelet receptor inhibitor specifically for Kawasaki disease. So administer puta og IV immunoglobulin, IV IG to reduce inflammation. So this IVIG is an immunoglobulin specific for Kawasaki disease, given within the first 10 days of the disease, reduces the risk of damage for coronary arteries, damage to the coronary arteries of the heart. So we are now going to move through rheumatic heart fever. So it is an autoimmune rheumatic system inflammatory disease that is caused by Group A beta hemolytic streptococcal infection, which involves joints as in rheumatic arthritis. So since a rheumatic arthritis, nag-involve siya sa joints, but the difference with rheumatic heart fever is that the joints affected in rheumatic heart fevers are much more, because it's going to be polyarthritis. So etiology, follow post streptococcal infection. So we are going to ask the patient, does the patient have a streptococcal infection? So if the patient has streptococcal infection like tonsillitis, pharyngitis, strep throat, it is likely that the patient will develop into a rheumatic heart disease fever. So fibrin deposits on the endocardium and valve, particularly in the mitral valve. So asa dapit ang mitral valve, it is located in the left or right. So tricuspid is in the right, so nasa sa left ang mitral valve, as well as
major body joints. So paki-check lang if sakto ba to kung giingon nga mitral valve kay sa right ay sa left. So symptoms of original streptococcal infection subside in a few days with or without antimicrobial therapy. However, after 1 to 3 weeks, if child was not treated appropriately, onset of rheumatic fever begins. So mawala ra ang symptoms for streptococcal infections with antimicrobial therapy, but if it lasts for more than 1 to 3 days and the child is not treatment, then it is the beginning of rheumatic heart fever. So we have here Jones criteria. We have two kinds of characteristics with this in which we have to memorize or familiarize because this is a board sensitive na question. So Jones criteria has major characteristics. So it is stated nga important man nato mahibaw anang major and minor because these are the ones that is going to make us identify if the patient really has a rheumatic heart fever, because what if na siya symptoms na ilani pero like wala dili din siya con. So ang giingon I have read which is not stated here, but if you have two major signs, major characteristics, then it is rheumatic heart fever. And if you have one major characteristics plus two minor, then that is also the Jones criteria. So carditis is inflammation of the cardiac, so makakause tachycardia. Polyarthritis, this is what I've been talking about, the tender swollen large joints. So sa minor na characteristics is there's only a little bit of arthritis, not poly. Chorea, what is chorea? It's a sudden involuntary movement of the limb, like it's involuntary, like kalitra siya glihok. And erythema marginatum, so there is a difference between erythema marginatum is like generalized, and there's also erythema something that is localized. So macular rash found on the trunk, so as you can see in the baby here, doy kaayo. So subcutaneous nodules, painless lumps on the tendon sheath. So as you can see here, nagbukol na siya guys, and large joints are swollen and tender. So I would like to just add some ay nagbalik siya sa start, no? Sige lang, you can go back naman. This is something that I have been finding to be a nuisance. But we can try our best to not express every feeling that we have. I mean, express siya, pero like not for too long ba. Kay makadaot na siya sa tuang day. Makadaot siya sa tuang day. So we have major, so joints, erythema, chorea ni siya, which has involuntary nodules, and argemaginatum. Okay, so we move on now to the musculoskeletal disorders, where we have osteogenesis imperfecta as the number 1. So it is a connective tissue disorder that leads to recurring fractures. So the baby is very sensitive to falls, like gamay falls lang mabali inadayon ni siya. So kani uli na pud din nato, straight na pud din nato, mag interventions na pud ta, mag surgery na pud ta, pero like if you are going to completely, because if you are going to fall again, mabali na pud ni siya kay recurring mga fractures, so because of the sensitivity. And why does nagkailani man ni siya? So there is a reduction of the creation of collagen in connective tissues, which is what I infer to be the what will make the joints strong and collagen. So there will be a lax joints or lazy and weak muscles and increased fracture. So how do we assess for this? So look at the teeth. It is a very doy kayo, no? So frequent fractures, thin skin with easy bruising. So dali ra siya ma-bruise and dali ra pud siya like ma-fracture. So weak muscles, blue ang sclera. Nganong naga-blue naman iyang sclera? Results from decreased oxygenation to the sclera because of decreased collagen. So important kayo ang collagen, no? As this is the what makes our skin young, manggod pod. And if there is decrease in this, manggako siya blue ang sclera, and short stature, which is na stunt iyang growth. It is very risk for injury jud ni kay, di ba, dili connective tissue disorder that leads to recurring fractures. So interventions, we handle children gently. So dili nato siya lambos ang bata, no, di mo siya nato dapat ilambos ang bata, pero labaw na ni. So gentle la kaayo. So keep floors dry because again, they are at risk for injury, and then if they fall, then they break, and they break really easily. So never hold ankles when diapered. Okay. So even if we hold nimo ang ankles, no, so grabe siya ka sensitive that if imong i-hold ang ankle, it could possibly be hurting the baby. Like, how is that even possible? You can diaper the baby with that. So interventions, we have medical management, we have calcitonin, which aids in bone healing. So this is a hormone bang calcitonin? Yes, it is a growth hormone, which is hindi mao kani ang growth hormone, which is from the pituitary. So calcitonin unsay nagkuan ani nga brain part, thyroid ni siya, di mo ni brain part. So kailangan nimo i-remember yung anatomy asa nagikan si calcitonin. And biphosphonates increase bone mass. Okay, so for bone mass, growth hormone stimulates bone growth. So developmental dysplasia of the hip, improper formation of the function of the hip socket. Wala siya ni fit ang femoral head of the socket. So this is the ilium, the femoral head. But in the developmental dysplasia of the hip, wa siya na kuan siya, no? So ang resulting ani niya kay mo ni ang hips and mo ni ang normal na connection. Like we can say nga ang dysplasia is naa diri. So like ang resulting ani niya na gamay lang tawon ang iyang tiil diri, no? Ilana ba? So femoral head and acetabulum are improperly aligned and slips out easily on movement, which is unknown ng iyahang cause, but associated with maternal hormone relaxin and estrogen. So makapahumok mangod ang relaxin kay relax gani. So basta. So shortening of the affected limb ang mahitabo, signs and symptoms, and which we can analyze, we can evaluate if dili sila same og length through the Alice sign. So unequal knee length. So ipahigda na tong patient, no, and then fold ang legs, and then we can evaluate. So we also have Barlow sign or ortolani sign, which is diri na to ma-hear ang ato ang pag-assess ani is through hearing. So in the supine na to ang patients, i-flex ang knees and up to 90 degrees. So as we can see here, so this is a female, and i-abduct na to ang hips, and i-biraho na to ang hips, and a clicking sound is heard. So like marshag TNJ ba. So nursing diagnosis is impaired physical mobility, risk for injury, delayed growth, and development. So medical or surgical management. So we have Pavlik harness, infants less than 3 months. Pavlik harness, infants less than 3 months, kay atoa siyang ipa. So the way we can remember this Pavlik harness is this, like looks like an H, diba? So harness, Pavlik harness. So holds the hip flex, abduct, and externally rotated, worn for 3 to 6 months. So temporary temporary siya kay maulian naman hopefully ang bata. So skin traction followed by spica cast infants with older than 3 months. So kung less than 3 months, we have is equal to Pavlik harness. And if we have, oh, this is a greater than sign, sorry. So less than and greater than 3 months, we have this, say tawag ana, spica cast, skin traction followed by spica cast. Okay, skin traction followed by spica cast. So older than 18 months require traction. So saan mo na pag-perform? Operative reduction and rehabilitation. So child and family, we educate for pelvic harness. So focus on irritation prevention. So how can we help the baby be alleviated from the irritation? So i-diaper para walay moisture. So di mo na ubano di ka afford og diaper. So saan man na nila. So mag-think po ta na ways for helping them to talipes deformities or club foot. So ankle foot deformities where the foot is twisted and fixed in an abnormal position. So this is an abnormality that can be fixed with, if a baby is the earlier the management, the better. So club foot, we have two kinds, is inward and outwards. So for varus is turn in varus. For valgus, it's valgus. So ano siya. So ako lang tuman ang varus. So dorsiflexion is lower than the foot. So kung i-dorsiflex nimo, lower than the foot siya. So plantar flexion, foot is lower than the heel. So hindi ko siya ma-visualize. So can you please help me with that? So assessment, deformity is apparent at birth. The affected foot is usually smaller and shorter with an empty heel pad. The affected foot is usually smaller, okay, and shorter with an empty heel pad. So risk for injury, risk for impaired skin integrity, risk for peripheral neurovascular dysfunction. So serial casting for 8 to 12 weeks. Casts are changed every 1 to 2 weeks. Infant may need to sleep in Dennis Brown splints. Oh my gosh, wao kabalwan. Brown splints. Na para maanad daw ang mga muscle ligaments sa tiil. So this is for serial casting for 8 to 12 months. Dayon, change siya every 1 to 2 weeks. And mag-sleep siya with Dennis Brown splints para maanad daw ang mga muscles ligaments sa tiil. So mo ni ang Dennis Brown ni splints. So to Dennis Brownie splints. So surgical management, tight ligaments are released, tendons lengthened or transplanted. Bones are realigned in the foot held by steel pins. So then casting for 6 to 12 weeks ang mahitabo. So bones are realigned in the foot held by steel pins. Realigned ang bones, and held na to siya by steel pins, casting for 6 to 12 months. I-change maka siya for 1 to 2 weeks. Change for 1 to 2 weeks, and serial casting 8 to 12 weeks. For 8 to 12 weeks siguro ni na mga baby or sa 6 to 12 weeks na po dari yung bones are realigned held by steel pins, casting about 6 to 12 weeks, serial casting for 8 to 12. So child and family change diapers frequently, sponge bath the infant, explain Dennis Brown splint or corrective shoes para mo strengthen daw imuhang muscles. So autoimmune inflammatory disorder. So antibodies are developed against own body cells. Ila na man jud ang mga rheumatic no kay autoimmune. They attack their own body cells. Inflammation of synovial joints. So what are synovial joints? This is the part of the synovial joints. Antibodies erode the articular cartilage, decrease joint functions. So assessment, intervention, and balik ra ko ha kay tapay sa ko. Inflammatory disorder, mo-attack siya sa synovial joints which causes it to decrease in functions over time. Magka-grow na siya capillaries, then dire mo na yung capillaries, dire yung dapita, and then magka-decrease ang joint function which would mas stiff na siya, dili na siya mulihok. So kailangan siya to help that we provide medications such as steroids, NSAIDs, and DMARDs. But also pod helpful ang passive movements every time. So we assess this as morning stiffness, sudden inability to walk on one leg because this does affect the legs as well and the fingers, and mukalit ra siya fuse ang bones. So, di na siya makamove. Intermittent joint pain and decreased ROM. Nursing diagnosis, chronic pain, impaired physical mobility, self-care deficits. So, chronic pain, jud ning GRA, no? We have interventions. PT na to siya, physical therapy. Encourage non-weight bearing exercises. Kanang dili pod ni mabali biya kay possible di ba nga ga-fuse niya kung mag-squats ka dira with dumbbells mabali ta. Apply heat every morning. So what is the kanang nakanindot sa pag-apply sa heat? So warm bath in the morning. So we also provide warm bath in the morning para what is the purpose of kuan jud kanang heat. So medical management is NSAIDs. We have ibuprofen and naproxen to control pain and inflammation. So cytotoxic drugs for severe arthritis when NSAIDs have failed. So again, ibuprofen and naproxen to control the pain and inflammation, and cytotoxic drugs for severe arthritis when NSAIDs have failed. So mo na siya DMARD, cytotoxic. So scoliosis is lateral curvature of the spine. So dire kay mag-talk about na to sa mga degrees. So muna yung tinatawag na thoracic scoliosis. It could be either be thoracic or lumbar. So the primary lateral curvature of the spine, when the child holds the head level, a compensatory second curve develops an S-shaped appearance. Thoracic rib cage is a very protuberant convex curve. So brow straps are unequal curves in the vertebral spinous process, prominence of one hip, prominence of the scapula, and taas ang scapula niya. Clothes do not fit right. Skirt hems are uneven. So risk for injury, disturbed body image, impaired physical mobility, risk for impaired skin integrity. So management is if spinal curve is less than 20 degrees, no therapy is required. If greater than 20, less than 20, none. Greater than 20 and less than 40, so 20 to 40 is bracing is the prime intervention, and Milwaukee brace ang ginagamit na to ana. So Milwaukee brace is an underarm thoracolumbar support worn for 24 hours per day. So less than 20, none. 20 to 40, bracing. Ano yung spelling sa Milwaukee? Milwaukee. Underarm thoracolumbar support worn for 24 hours per day. Thoracolumbar support for 24 hours per day. Thoracolumbar support for 24 hours per day. So, hollow traction, use of opposing forces to strengthen and reduce spinal curves. So, what do you mean by opposing forces, no? Mag-use po tag hollow traction. Wala na siya sa quiz. So, surgical management, if curve is greater than 40, so parang sa itong hollow traction, opposing force and to strengthen and reduce spinal curves. So, if greater than 40, Harrington rod replacement na itong buhaton. So, surgical repairment, Harrington rod replacement, rods and bars. Flat on bed for the first 24 hours, log rolling every 2 hours, maintain good posture. That's all.